Hi, you guys. Welcome to our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to get into my disclaimer slash reminder before getting started. Just that we know there's no absolute in medicine. We treat on a patient by patient basis. And any other questions that you see here, I have designed based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of the videos that I have that I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one. Question number one states a patient presents to the office with complaints of itchy eyes with watery discharge. Upon examination, the nurse practitioner notes a ropey, stringy, clear discharge from the patient's eyes. Based on this presentation, what is the best diagnosis? Is it A, bacterial conjunctivitis, B, viral conjunctivitis, C, allergic conjunctivitis, or D, Pterygium? Take a moment and tell me what you got in the comments, you guys. All right, you guys. So, I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states, based on this presentation, what is the best diagnosis? All right. So, I always say if we're looking for the diagnosis, you need to run it back and see what the assessment findings are. How are they presenting, right? What are their complaints? What are those subjective findings? What are the objective findings by the provider? The patient comes in, they're complaining that their eyes are itchy and watery. Upon exam, the nurse practitioner notes a ropey, stringy, clear discharge. This is one of those key identifiers, right? The thing I always say, when I say this, you say that. So when I say ropey, stringy discharge, you should say allergic conjunctivitis, okay? And then the other things play a factor. We see they have the itchy eyes, the watery discharge. But that ropey, stringy, clear discharge is classic presentation for allergic conjunctivitis, okay? So your best answer choice is C. All right, question number two. The nurse practitioner has diagnosed the patient with allergic conjunctivitis. What is the best treatment option? Is it A, levofloxacin drops, B, antihistamine drops, C, none, it will resolve on its own, or D, Cipro drops? Take a moment and tell me what you got, you guys. All right, so the stem of this question states, what is the best treatment option? So the best treatment. And then also, when I say when we're treating something, run it back and see what the diagnosis is. See if they have provided you with a diagnosis. If they haven't, you need to take it a step further and look at the assessment findings to come up with your diagnosis because we got to know what we're diagnosing to be able to treat it, right? So here they already provided a diagnosis. The nurse practitioner has diagnosed this patient with allergic conjunctivitis. In the last question, we even talked about this with the patient coming in with that ropey, stringy discharge, itchy eyes. So how would you treat this patient? Now, the most common treatment is B, antihistamine drops. That'll help with the itchiness and helps resolve those allergy symptoms in that conjunctivitis. You can also tell them to put, if it's like a mild case, like compresses on their eyes, but B, antihistamine drops are the best treatment option. Remembering like that levofloxacin drop is more for our bacterial conjunctivitis, and then resolving on its own will be more of our viral conjunctivitis, okay? And then question number three for today. The NP student is inquiring, how did the nurse practitioner determine viral conjunctivitis versus allergic conjunctivitis? What is the best response by the nurse practitioner? Is it A, viral conjunctivitis doesn't have watery drainage? Is it B, viral conjunctivitis does not have itchiness? C, viral conjunctivitis is typically unilateral? Or D, viral conjunctivitis has purulent drainage? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question, what is the best response by the nurse practitioner? So what are we responding to? The NP student is asking the nurse practitioner, how does she determine viral conjunctivitis versus allergic conjunctivitis, which is a very good question, right? Is it A, viral conjunctivitis doesn't have watery drainage? Well, yes, it does. And, that's what makes it kind of difficult with determining allergic versus watery. They both do have that. Allergic conjunctivitis versus viral, because they both do have that watery drainage. Now, it's more specific with that ropey, stringy appearance with allergic conjunctivitis, but they both, viral and allergic conjunctivitis, have watery drainage. B, viral conjunctivitis does not have itchiness. Yes, it does. They can have some itchiness. It's more common with allergic conjunctivitis, but viral conjunctivitis does have itchiness sometimes uh, in their presentation. C, viral conjunctivitis is typically unilateral. This is your answer. Now, think about this. With viral conjunctivitis, they typically start with one eye, the unilateral presentation of their symptoms, whereas with allergic, it's typically bilateral, right? They typically come in with both eyes, watery, itchy, like the sinus style drainage and things, congestion, I should say, type presentation. Whereas viral conjunctivitis, they typically come in with that one eye watering, with some drainage, complaining of it, having some redness and irritation, right? Now, when it becomes bilateral, it's because they've been rubbing that one eye and rub the other one, and because it's a contagious um, diagnosis. So if they're rubbing one, they can spread it to the other. But C, your best answer, viral conjunctivitis is typically unilateral. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. And if you need any of the resources that I offer, feel free to reach out to the Nursing Studio at 803-400-6864. You can shoot a text message to this number as well, or shoot us an email at thenursingstudio, the number one, at gmail.com. My review book options, ebook and paperback, are both linked in the bio of this channel. The self-paced review course is also linked in the bio of this channel. You can see a preview of that class and the workbook associated with it if you are just looking to see more about what that entails. And then my one-on-one sessions, I always say reach out to me about that, because they are so individualized and so customized. Either if you want to work on a weakness, if you need an exam readiness assessment, or if you've been unsuccessful before and just need a customized study plan to work alongside me, that's the other option. So I always recommend calling, texting, or emailing so that we can determine what you truly need. But as always, you guys, make sure you meet me back here. Happy studying. Bye, y'all.